This videotape is designed to give a general understanding of nasal surgery, or rhinoplasty. It will include a brief discussion of the overall procedure, the operation itself, risks, and the healing process. The first visit to the surgeon's office typically includes an examination of the nose and may involve a more extensive physical examination depending on the patient's previous medical history and age. During this initial consultation, the surgeon discusses specific details of the case. These will most likely include an explanation of the surgical technique to be used, where the surgery is to take place, whether in the surgeon's office, an outpatient surgical center, or a hospital, medical insurance, fees, and finally, what the surgeon realistically hopes to accomplish. Prior to surgery, a typical patient is seen with a large nose, a hump deformity, an enlarged tip, and a nose that hangs slightly where it joins the lip. An incision is made on either side of the nose inside the nostril to provide access to the cartilage and bone of the nose. This will permit the surgeon to appropriately cut and reshape the supporting hard tissue, meaning the bone and cartilage, thereby changing the external appearance of the nose. The nasal hump is removed through the incision using either a special saw or rasp, leaving the bridge flat and the nasal bones and cartilage spread. In order to narrow the nose, the nasal bones are weakened at their base along the dotted line. The surgeon then brings the cut bones and cartilages together to form a new, narrow, and aesthetically pleasing nasal bridge. In order to reduce the size of the nasal tip and to give it better definition and refinement, a portion of the nasal cartilage is removed. The cartilage to be removed has been marked with shading. To improve the angle between the bottom portion of the nose and the upper lip, it is necessary to elevate the nasal tip. This is done by trimming the nasal septum. Again, this part of the surgery is done through the incision made originally in the nostrils. When a large hump is removed, the nose is left too wide at its base. In order to reduce this width, small skin wedges are removed, and the nostrils are brought closer to the center, narrowing the base of the nose and leaving a very small scar where the nose has been sutured. Following surgery, a splint composed of tape and a plastic or plaster overlay is applied to maintain the bone and cartilage in their new improved shape. This splint may be left on for up to 10 days, but is often removed within a week's time. Frequently, nasal packs are also inserted in order to protect the nasal septum, particularly if the patient has had septal surgery performed. If packing is used, it will be removed within 2 to 3 days. Swelling and discoloration around the nose and eyes will appear immediately following the surgery and may last up to 2 to 3 weeks or longer. During convalescence, you will experience some mild pain and tenderness, which can be alleviated with pain medication. You will be asked to keep your head elevated and apply cold compresses to reduce the swelling. We see the patient post-operatively with a smaller nose, a straight nasal bridge, a smaller, more aesthetically pleasing nasal tip, and an improved angle between the nose and the upper lip. Expectations from the surgery should be a nose which looks more natural. Not infrequently, the change brought about by the surgery may go unnoticed by others. The plastic surgeon's goal is not to create a new nose that draws attention to itself, but rather to create one that blends aesthetically and subtly into the overall features of the face. Rhinoplasty, like any surgical procedure, involves a certain amount of risk. However, when performed primarily to improve appearance, post-operative complications are few. Infection is rare. Nasal bleeding may require the surgeon to repack the nose with gauze, which may prolong healing. Although the patient may be up and about in a day or two, strenuous exercises such as jogging or swimming or any activities that might hinder the healing process are restricted during the first few post-operative weeks. The decision to go back to work will depend upon the degree of swelling and discomfort. In some patients, the swelling takes longer to subside, and the result of the surgery may not be apparent for weeks or months. This videotape has been developed by the American Society of Plastic and Reconstructive Surgeons, principally for use by its members. A surgeon who displays this symbol is board certified by the American Board of